Hello everyone, this is Bob Browner recording the 13th update in the series, and the themes today are why the models are wrong and also the fact that until we have some political leadership, I think we're going to rely on average Americans to get it right. The biggest problem, of course, is that we haven't done much about our meatpacking facilities, and this is the source of our epidemics in Nebraska. Part of the problem, and I would highly encourage you to read this podcast, Johns Hopkins put about a podcast together about COVID-19 and the law. You're seeing political squabbles at national, state, and local levels about who has the authority to actually do something. And they kind of review this, and essentially part of the problem is that the law is a little muddy in the area, and also the law is somewhat dependent on the assumption that political leaders will work and play together, well together in emergency, which has not been happening, it seems, at any level. So why are the models wrong? There's a good article, I like this one from Grist, about explaining why the models can get it wrong and frankly will get it wrong. And so one of my professors in grad school used to say all models are wrong, some are useful. And so it's not that the models are worthless, they are going to be wrong, but know why they're going to be wrong and why they might help you. And so this model I've been using, it's basically just put together with a simple Excel spreadsheet. You can kind of do the same thing with these assumptions. Basically, this isn't rocket science, it's just knowing how to do it. All these assumptions are potentially true. So what you're doing with the model is looking at underlying assumptions and saying, what happens if this happens? And so basically, if the infection rate's 5% and there's a low case fatality rate, then maybe we only have 482 deaths in Nebraska. But if the infection rate goes to 70% and the case fatality rate's higher, well, it could be 31,000. We don't know the answer to those questions yet. And part of it, what makes our models even more hard to predict right now, is that we're looking at models that also take into account how people will behave, how our political leaders will behave, and unfortunately how our businesses will behave. And that's going to be that's our biggest problem in Nebraska right now. So some of you may have seen the UNMC model from a week ago saying 50 to 80 deaths possible. Well, that was based on the best case scenario as we were doing 1 to 2 weeks ago, before we had our latest 2 hotspots and before we knew what our meatpack facilities were doing. Unfortunately, that has now made this model wrong. It wasn't because the model was running correctly, and Ali Khan here, I consider him a friend and a colleague, and I think it's great that we have him here. The problem is the model's assumptions, unfortunately, have after the fact proven to not be correct, but it was mainly political, not scientific, that was the issue. And so what you're seeing across the country is all these models all over the place, people debating, well, which one's right? Is this going to be Armageddon? Are we only going to have a couple hundred deaths? Is this much ado about nothing? The problem is sometimes I think based on people's politics, they're picking the model they like, without any assumption about why these might be wrong. The other problem is looking at academics who don't realize how messy public policy gets in the real world and how politics can pretty much mess everything up. And I think that's what you're seeing here. The models with their assumptions are correct, but only if those assumptions are correct and only if the implementation of the response is correct. And that is what's been all over the map. So all the models are wrong, get over it, but understand what the ranges are and why it might be this way versus that way. So what I want to talk about is why these models come about and how you can frankly recreate this with an Excel spreadsheet. We already now are starting to get more information to know, well, could the infection rate between 5% and 70%? Those are all possible, and they're possible based on politics and what we get right. And I'll use New York as an example of that. Also, the case fatality rate could be all over the map. It could be worse than we expected. And of course, if you overwhelm the health system, it gets much worse too. So our case fatality rate could be in this range still. So these are all still live options. What happens though is that creates a really wide range, and people want to say, well, if it's that must be wide range because we don't know anything. Well, actually, we do know quite a bit. What we really most don't know is how will our politicians respond, and will they get it right? And so the thing that what was gotten wrong in Nebraska, unfortunately, is that our meatpacking facilities are chink in the armor, unfortunately. This has been happening across the country, unfortunately. So we had, in Sioux Falls, it was the Smithfield plant. In Grand Island, it was the JBS plant. And now over this last week, it was the Tyson plant in Lexington. Essentially, I think they thought they were essential businesses, so they didn't have to do anything different. Did they put in things in place? Did they distance their workers 6 feet apart? Did they slow down the lines? Did they educate them, do hand washing? Appears not, based on what's happening. So if you look at what happened in Nebraska right now, of course, Omaha looks like a hotspot. It really isn't, because this is where a good portion of Nebraskans live. So if you population adjust it, Omaha and Lincoln, for example, are doing very well. Unfortunately, it's Grand Island and Lexington, and it's because of the meat processing facilities. So these are our 2 hotspots. That's why these cases are growing so fast right now. So Hall already, despite being much smaller than Omaha and Lincoln, has far more cases. I think you'll see Dawson leapfrogging Douglas County, a county that's far more people because of them being hotspots. So the 2 things that have me most concerned right now is if you look at all a lot of the major countries, you can follow on Johns Hopkins site. If you look at the number of cases versus deaths, case fatality rates, even in the best of cases, looks like in South Korea and Germany is 2 to 3%. I still think those are overestimates because Germany, despite its massive testing, isn't testing everybody. So likely there are maybe there could be 2 or 3 times as many actual cases, which would lower this down to the 1 or 2% range. But still, 1 or 2% is higher than a lot of people projected. This 10%, 13%, this isn't a real case fatality rate. What's happening here is these are countries that got caught really flat-footed and overwhelmed. France, UK, Spain, Italy, they've not done a lot of testing because they're diverting all their resources to their ICUs, trying to prevent as many deaths as possible, doing their best. Those are 4 countries who got most overwhelmed. Thankfully, we didn't do as bad as they did. We could have done better like Germany, but we could have done a lot worse. The other thing that has me worried is that the infection rate could be pretty broad. So essentially, if you take the slides earlier and you take New York City, which already has had 14,451 deaths and climbing, if you assume the case fatality is 1%, that means there are 100 cases for every death. That means 1.4 million New Yorkers have already been infected, which is 17% of their population. And if you assume there's any under if it's even wider, let's say the case fatality is 0.5%, then really it's 2.8 million or 9 million, which means already more than a third of New Yorkers have been infected so far. So we do know that the infection rates can exceed that 30 to 40% probably already in New York. And regardless of that, we can then go at the end and say, well, how many people in New York have died so far? 0.17% of their population has already died, and that's going to go up. If you take that same 0.17% and say, what's the cost of doing it all wrong in Nebraska? You can multiply the population of each county and see how many people that is. That alone, even at this number, which is probably not the full number yet, means getting it wrong means at least 1,000 people in Douglas County, at least 3,000 dead Nebraskans, at least 550 dead Lincolnites if we get it wrong. So this is not the time to let it loose and say, you know what, I'm tired of this, let's just open things up. Because we already know that if we repeat New York City, we're at minimum of this and probably higher. So that's why these projections are so wide. New York City is already at least 30%, I think, and probably heading towards 70%. There's a chance that 1% might not be high enough. It could actually be higher. So because there's a chance that this is still true, we have to act as if it is. If we do a good job, though, we'll make this happen in Nebraska. But again, it depends on our political implementation and our businesses listening and following along and not ignoring things at the sake of profit. So here we are in Nebraska already. This is the New York Times numbers from this morning, their graph that they have. If you go to the Johns Hopkins site, you can see the exponential growth starting. You plot sometimes we plot things in a logarithmic function because what will happen on a logarithmic function is when you hit the peak, it'll flatten. You'll see that this is not flattened yet. So that's why we can't really talk much about opening up in Nebraska because we have not flattened. So the response going forward, it's going to look like this. Tom Frieden, he was the former CDC director and informed by history and hundreds of years of understanding this. My biggest frustration is people saying, well, we couldn't have predicted this. Well, actually, yes, this has happened hundreds of times throughout history, and people who study the history of epidemics know this is what happens. You will have potentially a big wave if you didn't get it right. If you got it right, you may have a small wave, but if you get it wrong the second time, you actually maybe get a bigger wave. There will probably be multiple waves, and we have to plan for those multiple waves. We already know kind of what this looked like 100 years ago. So for example, Philadelphia did 100 years ago what New York just did. New York waited too long. I believe they closed their schools even later than Lincoln. So as much as some people like Cuomo and de Blasio, they waited too long. And although they're taking ownership and leadership now, some of this is their mistake by waiting too long. We could repeat history again. Omaha, Nebraska could have 2 peaks like this. We could do the St. Louis thing where we initially get it right, but then open up too early and not close fast enough and suddenly have a worse peak than the first peak. Or we could get it right. We could go to Minneapolis and we could repeat history and Minnesota history, not Philadelphia history, hopefully. So when to reopen, we are making progress on testing finally. So they were very restrictive up until this last week. They now are opening things up. So if you think you have coronavirus, call your physician and then they will direct you to the place to get tested. That's the next thing that we have to do. And then once we can see our sustained reduction, we can talk about opening up again. My biggest frustration locally is that we still do not have a coordinated approach to testing. I hope we'd have some organized approaches like the Germans and South Koreans, but we could not get the hospitals and the clinics and the health department to work together, unfortunately. So now testing is all over the city. So call your doctor. Some doctors' offices are doing their own testing. There are 3 drive-up sites. Bryan has its own down by Life Point. St. has its own up at North Star. Don Rice Urgent Care Center, they've got their own at 70th and Pioneers, or your doctor. So which one should you use? I don't know. Call your doctor and find out, and they'll direct you to where they think is the best for you. So we will still get more testing, but hopefully we'll have a more coordinated response going forward, because to open back up again, we need an early warning system. This would require us all working together, so hopefully this will be in place. We are still in what I would call the ramp-up phase, so we're still here, so it's a little premature to talk about opening it up quite yet, although people are doing it, because we're not there yet. We have to peak and then drop, then we can talk about opening up, but then we need a plan in place. That is a three-legged stool in my mind. You need public health, primary care clinics, and schools working together. Those three groups have not started working together. I keep asking. I hope our community will start pulling these together, but that needs political leadership. It's not going to happen until we have political leadership. It could happen at the city level. It could happen at the state level. Government needs to start relearning its neutral convener role that it used to have in the past. Here locally, we had Mayor Beitler convening this about 11, 12 years ago. At the state level, we had Senators Mike Glore, Whiteman leading this, so we could do this again if people would learn those skills. And we need to, because we need the government as neutral convener, because until then, we got to rely on all of you to do the right thing. The good news is many of you are actually doing the right thing. So I think a good explanation for why Lincoln and Douglas County, Lancaster County and Omaha and Douglas County are mostly doing well is because the majority of people, not all, but the majority of people are doing the right thing. Hopefully we'll get the legal issues straightened out. We'll get some leadership. But until then, you need to do the right thing. You need to keep at it. So I think Lincoln's rates are good, but we have to pace ourselves and keep up. One thing people need to do is, well, if you get sick, you need to be healthy ahead of time. So there's a lot of things you can do to prepare, because there's nothing that says that your political leaders won't get it wrong. So start working on your health. Get 7 to 9 hours of sleep. Go for a walk and get outside. The fresh air, the sunlight will be good for you. Plus, it'll help keep you from getting coronavirus. Don't smoke. We do know that smokers are more likely to die. The hand washing and mask will be very important. So if you're going to go to a place like the grocery store, for example, I would wear a mask, and I would wash my hands when I walk in the grocery store. I'd wash my hands when I walk out, and I'd wash my hands again when I get home and unpack the groceries. And then physically distance, but don't socially isolate. We still need to try to be social, and so I think using the social distancing was maybe the wrong term to use. So physically distance, and probably 6 feet's adequate, but make sure you're finding ways to get together. We're still doing the neighborhood get-togethers at least once a week, where we sit around 6 feet apart. We're out walking the dogs, saying hi to people. Just make sure you keep your 6 feet. We've been doing a lot of the Zoom meetings. Hopefully you are too. So stay in touch with people, and hopefully this is helpful to you. I will put a disclaimer out. This is the opinions of Bob Browner, not necessarily the organizations I work for, but these are the organizations I do work for. So you know that I actually do have a job. I'm not just some random person spouting off on this. On the top job, I run an organization that has 22 clinics. I do a nonprofit where I work on a large CDC grant. I'm an elected official on the school boards, and I'm the representative for the Nebraska Association of School Boards. These are affecting all of us. So coronavirus, just like it affects all of you, it affects every one of these organizations. And so this is why I put these out. Hopefully they're helpful for you. We will keep putting each on the series on the healthylincoln.org website. So if you want to see a past one, there it is.